what is balance for you?
Passion is very important.
Absolutely.
So you need to have that constant passion.
I think for me, the major challenge was I was actually trained as a healthcare professional. So all I know is to actually how to treat patients, how to talk to patients, and all. Through the journey, I learned that it's not about being a manager, but to be a leader.
What is up, guys? My name is Charles Liew. Welcome to BIZ Chat with Charles Liew Season 2. And we're still talking to real business people about real business stuff. But hey, why so serious? In this episode, we have Miss Christina Wong, the Chief Pharmacist and Director at Shine Pharmacy, Sdn Bhd. And we have Mr. Leandre Chai, the Founder and Principal Dentist at The Dentist Dental Clinic. This episode is going to be about healthcare. Okay, now obviously you have seen so many healthcare practices popping up everywhere in Sarawak over the past 2 or 3 years. So this topic is going to be, is healthcare supposed to be so profit driven as it is today? And we have two healthcare professionals in the private sector to help us dissect this. So Christina, we'll start from you. Why did you choose pharmacy?
I wasn't sure what I want to do after Form 5. So,
But your results were good.
Yeah, it was okay. Okay. Yep. And my mom suggested, why not you do pharmacy? But I was like, no, maybe not. Then we went to education fair, and the counselor said, if your chemistry is good, if you like it, you can do pharmacy. After going to pre-U, then most of my batchmates, they aim to do medical.
Yeah.
Then we went to the uni together to get like enrollment form and all, but I was quite sure I don't want to be a doctor, so I chose pharmacy in the end.
Okay, cool. How about you, Leandre? Why dentist?
All right. Starting in the beginning, my dad's a medical doctor, so I think he plays a really big part in my decision to become a dentist. But his wish was actually for me to be a doctor. I think, when I look at someone, I look at their smile. And I love looking at beautiful smiles. So if I can make a change in someone's smile, I think that brings me a lot of joy. And hence, I think I went down that path.
Tell us the difference between the hospital setting and the private sector in your respective field. So start with you.
When I started off, after I graduated many years back, at that time, actually, we were meant to go into compulsory service into government. And after that, we need to serve the government for another 3 years. So it was the policy back then.
Sure.
So I had the chance to actually get trained in civil hospital for housemanship, which is the PRP year. And I get posted to Sarawak General Hospital for another 3 years plus serving in the hospital. Yeah, and also get to involve in the setting up and during the initial phase of Pusat Dental setting up.
I did my government service in Johor. For my time, once we enter into service, we are all under contract. Compulsory was 1 year. It's called DO, or we call it an NDOP.
What's NDOP?
NDOP is a new dental officer program.
Sure. Okay.
Yeah.
Okay.
So that program, they give us 3 years contract, and 1 year is compulsory.
Sure.
So after I finished 1.5 years, I decided to come out to private.
So when did the thought of coming out into to private actually go into your head?
I want to do better.
Okay.
I just want to do better. I want to give the best if possible.
So you were frustrated in the hospital setting?
Yes.
Okay. And so how was the experience doing 1.5 years of private experience in Johor?
Oh, it was great. A lot of wonderful exposure.
Yeah.
A lot of new things that we learned. They can be tough at times, but
Sure.
Mainly was that exposure to really a lot of growth in private practice as well.
So with Leandre, we discussed about the public sector and the private sector. So how is it different in the pharmacy industry?
Actually, kind of similar. There's a bit of similarity with what he had shared earlier on. In government, we have really so much patience to serve every day. So sometimes, like we do counseling, and also, I thought I learned like a quite substantial amount of like so-called the clinical knowledge in a government setting, in a hospital, whereby most of the young graduates will be thinking like, oh, after I graduate, I must go into hospital so I can learn more. But not considering private because they feel like private is I can't learn much. But entering into private, it actually makes me become a better pharmacist that I used to be.
Absolutely.
Meaning to say I need to be really sure what I'm doing. I need to know a lot more than just drug alone. I need to learn to manage patients' expectation, to manage patients' conditions, to really know when to refer and not to.
You really start to understand the patient and not just it's not just a name on the file. Yeah, perfect. Last question before we go to a break. Why have you two decided to start your own business?
Yeah, the main reason is just to try to elevate the quality of dental care in Kuching. That thought with that vision in mind, I think, yeah, that just made me come back, help the community over here.
Brilliant. How about you, Christina?
We have seen what Australian pharmacy system, how the system works actually. So I've visited Australia a few times when Charles was in Australia. So we have seen how an Australian system works, and we felt like actually at that time, I think more than 12 years ago, the pharmacy industry is very much different from what we all know now.
Absolutely.
Yep.
I think, but as a pharmacist, like being in hospital, so you know what we can do, like to really provide the counseling and to really help the patient to get better. So at the same time, at that time, I think there's only the big chain like the beauty store, like Guardian & Watson's, those beauty stores. So there's a gap in between that. We think we can actually fill the gap and provide the better services for the patients here. At the same time, also give them the convenience as well.
She's a Shine Pharmacy, and I'm also Shine Pharmacy, and I'm the founder, and she's my wife. So I think it's important for us to have context, and context is in the form of, we see the gap between government and then super retail type of pharmacy. There is this niche that we could go into. Anyways, guys, we'll go to a break, and when we come back, we'll talk more with Leandre and Christina. Talk to you guys later. Welcome back to BIZ Chat with Charles Liew. I'm Charles Liew, and we have Christina Wong and Leandre Chai still with us, and we're talking healthcare today, okay? Now, let me ask you guys, what are the challenges that you are facing in the private sector every day?
Plenty of challenges. I think the main thing that I struggle with, constantly having problems, is physical pain. Physical pain in terms of backache, neck ache. Oh, it's ridiculous.
Okay. Apart from that,
mental as well.
okay.
There's so much concentration needed when you're dealing with a small tooth like that.
Yeah.
You have a lot of macro movement with your fingers.
Yes.
Your eyes need to be really focused.
Yeah.
And on top of just doing TV, we also need to come up with diagnosis.
Yeah.
Need to talk to patients.
Yeah.
Really having communication.
Keep them engaged.
Creating relationships as well.
Yeah.
Because you don't want to be like a robot, in and out,
Yeah.
So you just need to talk to patients.
Yeah.
Spend a lot of time talking,
Yes.
discussing, finding out what's the problem, and creating a treatment plan for the patient.
Yeah. I've had so many discussions with the candidates that I interview on a daily basis, especially the Gen Z.
Yeah.
They talk about balance.
Yeah.
I want balance. I always ask, I throw it back to them, explain balance. So let me ask you, like, what is balance for you?
Passion is really important.
Absolutely.
So you need to have that constant passion. Other than that, I feel like the group around me, I think is really important as well, because as leaders, you do delegate jobs amongst the rest of the group, but they need to be constantly supporting you. Otherwise,
Absolutely. Yeah.
you can't carry on.
Yeah.
It's just really tough.
Absolutely.
Because if you bear all these weight on your shoulder, it's tough.
Yeah.
So we need to figure out trying to find people to help us in.
Absolutely. Thanks. Christina, major challenges in the private practice?
I think for me, the major challenge was I was actually trained as a healthcare professional. So all I know is to actually how to treat patients, how to talk to patients, and all. from being a healthcare professional to being a manager, which I thought I need to be a manager, until through the journey I learned that it's not about being a manager, but to be a leader. And it was really challenging, and managing, talking to patients, managing patients, and all, those are what we need to do. And I'm really happy to do that. Dealing with and handling a lot of issues and phone calls and everything, from the biggest thing to smallest thing in the pharmacy, day-to-day, non-stop. I think for the past 11 years, I think it was not easy, but...
Don't start crying.
Yeah, no, I won't cry. But I think I learned it. I learned that I think the challenges is to actually not dwell into the problem, but to see as challenge. I was and I still, I was like a more negative people, you know. Like I always say, yeah, very hard lah, cannot lah, those kind of things. So to actually overcome this bit, and to to continue to move on and to actually learn to be a better leader, rather than really I was trying to carry everything on my own. So I think that burns me out at certain stage. So learning, and also to actually learn to maybe the challenge would be to actually develop like a system to how to actually involve all the talents to do different things. I think that's the challenge.
Absolutely. Anyways, I love that. Now, next question before we go to the break. Why do you think healthcare is so profit-driven today?
I think maybe we can just take pharmacy for like for these days. I think everyone can see like pharmacies all everywhere. We actually need to dispense with the prescription, but in Malaysia, pharmacy can't do that. So a lot of pharmacy, in order to make sure they make money with all the operating costs and all these things, they actually have a lot of in-house product that they actually make sure that the staff actually need to sell to that amount to make sure the business is sustainable. But for me, and for us, Shine, we don't think that's the way forward, which is patient, if they need the supplements, yes, we can recommend. But you actually still have to go back to service the patient and serving the patient with the right intention.
How about you? Like, why do you think health has become so profit-driven today?
It's not necessarily a bad thing. It can be a good thing as well. Profit-driven, yes. I think it's really important, because otherwise, who's going to pay our bills?
Absolutely.
At the end of the day, we are also providing job opportunities for people, and they also have a family to feed. And I think you still have to have that profit-driven mind.
Absolutely.
But to what extent? Now that's a deeper question.
Brilliant answers from you two. Guys, we'll go to a break. When we come back, we'll close out the entire thing. So see you guys then. And we're back to BIZ Chat with Charles Liew, and you're still with me, Charles Liew, and Christina Wong, and Leandre Chai, and we're talking about healthcare today, and we're wrapping up. Now, some heavier topic to wrap up, right? Because we gotta talk about something current, okay? And so we see so many big companies coming into Sarawak in particular and buying up a lot of Sarawakian businesses. So how do we feel about this? We'll start with Leandre.
For me personally, I feel like because I'm Sarawak and I have my own clinic, my own practice, there's always that Sarawak local touch to what we do, and I'm not a big fan about other companies buying over. Things may not go well. In what sense we are letting maybe other people control what we can do for our community.
There's less autonomy because you are at their
control. At the control.
Yeah. Okay. Understand. Okay. Thanks for that. Short and sweet. You can add on later. How about you, Christina?
For me, it's just that if everyone converts into the big chain, we lost the personal touch. And of course, maybe from certain business point of view, those decided to sell, they might not be doing that well in that regards. I mean, like that's what we are aware of. So But selling off everything, I think, may not be the way forward, because we want to actually do what we can do for the patient. That we sell off, we have no rights to say anything. We have no rights to decide, oh, come on, let's do this for the patient, let's do this. But it will basically actually all become sales target.
Actually, we are closing out. So the last question, you have already spoken to the camera. What is your one message to our audience?
For me, we got to look at passion. So if you want to study in the industry, you need to have passion, like how I had mine, creating smiles. That's number one. Now, for maybe dentists, colleagues around me, I feel a very important thing is having a good support. Because if at the beginning you start off with, I want to do this for my patients, but after years go by, you get drained out, you get burned out, and you're like, I just do it for the money lah. So with having great support or a good mentor, then your career can progress even further.
How about you, Christina?
I think first and foremost would be probably to all the students, maybe for A-levels or maybe younger students that want to pursue pharmacy. Pharmacy is something that not just I ended up like different direction now, but when I started off, I not sure why. But if you really do pharmacy, bear in mind that I think patience is the key word. We must remember we are only a healthcare professional, we are only a pharmacist if there's patience. If there's no patience, we are nothing.
Sounds good, yeah.
If there's patience, we are nothing. So because we always have different intern students attaching with us at our pharmacy. So I always share with them make sure, don't forget why you are doing this. It's not about just motivating yourself, but just that you got to be the pharmacist that really cares for patient and not just doing work. And they always have career advancement and all these things. But to be honest, to grow constantly, it does not reflect in just the title, just what is being given to you on paper. So basically, really just have to bear in mind that patience, number one, and it's not how you want to keep brainwash yourself to stay motivated, but don't lose the focus and the vision. For all the pharmacists, especially like colleagues in private setting, don't give up easily. Improve ourselves, actually, I think that's the most important thing, to not focus on other people and keep looking at what other people do. Do what we can do to improve ourselves, actually. I think that's the most important thing. In terms of maybe probably to people who can make the law, who can change rules and all these things. Probably, I think because it has been said, but I don't think it has not come to true yet, or maybe it's not being in practice yet, which is the zoning. I think it can help to solve whatever oversupplying issue, whatever issue that is happening now. That everyone will get their piece of cake, I think, because then the patient will get whatever care that they can actually get, the better care that they can get. It's not diluted by just money or profit alone. In fact, they can actually enjoy that community, because it's like you can actually refer to overseas system. Actually, they have like zoning. At certain area, there's only maybe one or two clinics, one dental clinic, then how many pharmacies.
So there's a radius limitation as to how many pharmacies could be inside. So you can't open next door.
I think every party is actually. It's not about the amount of pharmacy or amount of stores you can open, but in a way you are servicing that community, and definitely you can improve the service and not just based on purely numbers. Yeah.
You can see like at the 3rd Mile area, for example, there are like 13 or 14 pharmacies alone around you, around your clinic, right? So it's that is something that has huge repercussion, and it is in advanced countries. Zoning and dispensing separation have been around so much that people like you don't even know that it's a thing. So it is an issue that kept on getting mentioned. Anything to add before we wrap up? Because I think it has been a very fruitful session. No? Thank you so much, guys, for being a part of BIZ Chat this season. So guys, listen, healthcare, it is a right. It is your right to have healthcare. And when it is being overly commercialized to the extent that you feel you're not being looked after, then it is an issue. It is an issue in the United States, in the UK. We are always striving to make healthcare more accessible, more available, and more affordable. To what extent can we do that? How well can we do that has been something that political parties around the world have fought about, and winning elections and losing elections purely based on healthcare alone. So it is something extremely important. It is your right, and it is up to you to choose what kind of healthcare providers you will support to allow them to prosper, right? And allow you and your loved ones to prosper as well. And so to that, we will bid you goodbye. Until the next episode, guys. Bye-bye.